14 warning signs of toxic or diseased kidneys. The kidneys are among the most important organs in your body, responsible for filtering waste, producing red blood cells, and even keeping your bones strong and sturdy. But despite the many vital roles they play in maintaining a healthy, high-functioning body, it can be hard to determine when these bean-shaped organs aren't operating at full capacity, especially in the early stages of certain kidney problems. 1 in 3 Americans are at risk of developing chronic kidney disease, CKD, and fewer than 50% of those with severe CKD know they have a problem. With that in mind, we've compiled the following most common and debilitating signs you may have a kidney problem. Talk to your doctor immediately if you notice any of these potential CKD signs and symptoms. 1. Having back or side pain. Since your kidneys are actually higher up in your abdomen underneath your rib cage, a kidney infection can cause intense pain in the middle to upper back area. Kidney stones, which are hard deposits of salt and minerals that form inside the kidney, can be extremely painful when they pass through the ureter and bladder. You'll know the pain you're experiencing is from kidney stones when it's in your side and back and comes in waves, not unlike a kidney infection. 2. You're always tired. Your kidneys filter waste from your blood and ship it out in the pee. When your kidneys don't work properly, toxins can build up. One common tip-off is fatigue. You may feel spent, weak, or have trouble concentrating. Kidneys make a hormone that tells your body to create red blood cells. If you have fewer of them, your blood can deliver as much oxygen to your muscles and brain as they need, and this makes you feel tired most of the time. 3. Poor sleep. Studies show a strong link between sleep apnea and chronic kidney disease, CKD, which over time damages your organs and may lead to kidney failure. Sleep apnea may hurt your kidneys in part by preventing your body from getting enough oxygen. CKD in turn may cause sleep apnea by narrowing your throat, toxin buildup, and other ways. 4. Dry and itchy skin. This may happen if your kidneys can't flush out most of the toxins and they start to build up in your blood. That can cause a rash or quite often make you itch all over. Over time, your kidneys may not be able to balance the minerals and nutrients in your body. This can lead to mineral and bone disease, which can make your skin dry and itchy. 5. Swollen face and feet. When your kidneys can't get rid of sodium well, fluids start to build up in your body. That may lead to puffy hands, feet, ankles, legs, or a puffy face. You might notice swelling especially in your feet and ankles. If you press on these swelling skins, you will create a dent which doesn't bounce back as quickly as normal skin. And protein leaking out in your urine can show up as puffiness around your eyes. 6. Muscle cramps. Cramps in your legs and elsewhere can be a sign of poor kidney function. Imbalance in the levels of sodium, calcium, potassium, or other electrolytes can interrupt how your muscles and nerves work, which leads to crampings. 7. Foggy head. When your kidneys don't filter most waste out of your system, the toxins can affect your brain. Anemia also may block your brain from the oxygen it needs. You may feel dizzy and have trouble with concentration and memory. You may even become so confused that you have trouble with simple daily tasks. 8. Foul breath. When your kidneys can't filter out waste, it can cause a condition called uremia. That can make your mouth smell, and this smell does not go away after brushing. Also, toxins in your bloodstream can give food a metallic or off taste. 9. Foamy, brown, or bloody urine. Bubbly pee could be a sign of too much protein in your pee, called albumin. Bubbly pee can result from kidney issues if it shows up often. If you just had a big meal with lots of meat, bubbly pee may show up but should come back to normal after a day. Brownish or very pale urine are signs of kidney issues, too. Faulty kidney function also may let blood leak into your bladder. Blood in your urine also can be caused by kidney stones, tumors, or an infection. 10. Frequent urination. If the kidney filters are damaged, it can cause an urge to urinate, especially at night. Considering that frequent urination is also associated with health issues like diabetes and urinary tract infections, this symptom definitely merits a treatment. 11. Swelling around your eyes. Kidney disease can cause extra fluid and sodium in your circulation, which then leads to swelling in different areas of the body, often around the eyes when the issue is kidney-related. In the case of nephrotic syndrome, in which too much protein is secreted through the urine, swelling also occurs due to lower levels of albumin in the blood. 12. High blood sugar. According to the National Kidney Foundation, diabetes is the leading cause of kidney failure, accounting for 44% of new cases. Due to the toll diabetes takes on the kidneys as a result of the damage it does to the body's red blood cells, diabetics are also at risk of developing diabetic kidney disease, a condition that further reduces proper kidney function. 13. High blood pressure. Excess fluid and sodium buildup as a result of kidney disease can cause you to have higher blood pressure. High blood pressure can also damage the blood vessels in the kidneys and lead to a worsening of kidney disease over time. 14. Chronic nosebleeds. Granulomatosis with polyangiitis, GPA, is a disease characterized by swelling of the blood vessels in the kidneys, nose, sinuses, throat, or lungs. According to the American Kidney Foundation, the first sign of this condition is usually a runny nose or frequent nosebleeds. Though GPA doesn't always affect the kidneys, when it does, it can lead to chronic kidney disease or even kidney failure, so it's important to speak to a doctor if nosebleeds become a regular occurrence. Are symptoms of kidney disease different in men and women? Although they both may experience the same symptoms, CKD may progress differently in men and women. Urinary tract infections, UTIs, and kidney infections are more common in women, which may cause kidney disease to develop. In general, women have a greater risk for CKD, whereas men may progress to end-stage renal disease, ESRD, or kidney failure faster. Both men and women can lower the risk of kidney disease by maintaining a healthy weight, controlling blood sugar, and living a healthy lifestyle. Tips to keep your kidneys healthy. There are several effective ways to reduce the risk of developing kidney disease. So, why wait until your kidneys are diseased? Following are a few steps to look after the health of your kidneys. Drink plenty of water. This is the most common and simplest way to keep your kidneys healthy. Consuming plenty of water, especially warm water, helps the kidneys clear sodium, urea, and toxins from the body. Low sodium/salt diet. Keep your sodium or salt intake in control. This means you need to cut off packaged/restaurant foods too. Also, do not add extra salt to your food. Low salt diet decreases the load on the kidney and prevents the development of hypertension, hypertension-related disorders, and also delays the progression of kidney disease. Maintain appropriate body weight. Eat healthily and keep your weight in check. Get your body cholesterol levels checked regularly to prevent the deposition of cholesterol in your renal arteries. Also, eliminate saturated fat/fatty fried foods from the diet and emphasize on having lots of fruits and vegetables daily. The load on the kidneys increases as the weight of an individual increases. Try to aim for a BMI of 24 or less, especially in the Indian scenario. Check blood sugar levels regularly and keep them under optimal levels. Kidney damage in diabetic patients is very common and can be prevented if detected early. Therefore, it is advisable to keep a regular check on your blood sugar levels, avoid sweet food products and meet a physician if blood sugar, fasting or postprandial levels or HbA1c are raised. Keep HbA1c levels under 6.0. Monitor blood pressure regularly and keep it under control. In case you have hypertension, take antihypertensives as advised by your doctor, maintain a healthy lifestyle and make necessary dietary changes. The normal blood pressure level is 120/80. High blood pressure can also cause kidney disorders besides leading to a stroke or heart attack. Get kidney function tests, and urine analysis is done regularly as a part of your annual checkup. As I mentioned before, in case you have diabetes, hypertension, obesity, or if you are over 60 years of age, get kidney function tests, renal imaging, and urine analysis was done regularly. In case of even slightest protein detection in urine, make sure to visit your nephrologist. Diabetics should especially be watchful of quit smoking. Smoking is one of the important modifiable risk factors implicated in the progression of kidney disease. Even smoking one cigarette could further harm an already weakened kidney. Smoking is also a risk factor for diabetes, hypertension, CAD. Thus, one should stop smoking at once, which is quintessential not only for the kidneys but also for the overall health of the body. Maintain an active healthy lifestyle by doing moderate exercise around 45 minutes a day like jogging, cycling, swimming, playing racket games at least 5 out of 7 days in a week, if not daily. Change your sedentary lifestyle, walk around in the office or take a stroll after lunch. Balance your lifestyle properly by taking a restful night's sleep of at least 8 hours a day. A good night's sleep is essential to remain healthy. Eat healthy. Some foods are very friendly to your kidneys, such as leafy greens, asparagus, kale, celery, and fish, other seafood and high-quality meat like grass-fed beef. Summary. Detecting chronic kidney disease, CKD, can be tricky because the signs and symptoms of kidney disease occur late, after the condition has progressed and kidney damage has occurred. In fact, CKD is sometimes known as a silent condition because it's hard to detect, and most people with early-stage CKD are completely unaware of it. You're more likely to experience symptoms in the later stages or end stage of kidney disease. If you are at risk for CKD, especially if you have high blood pressure or diabetes, it's recommended that you get screened at least once a year for any evidence of kidney disease. Your doctor can give you a blood test that will measure your creatinine levels and help determine your level of kidney function. The earlier CKD is detected, the greater the benefit of early treatment.